Yeah, believe it or not, nothing's supposed to touch the eye. Not makeup, not the wind, air, dust, not contact lenses, not even your eyelid.
Sometimes when your eyes are constantly watering, it's easy to assume that they're too wet. But in many cases, it's actually a sign of dryness. It's a common misunderstanding and one of the reasons dry eye disease often goes unrecognized. I'm Mark Donison, and today with Dr. Wynn, we'll break down what dry eye is, why it happens, and how it can be managed. Let's get started. Dr. Wynn, thank you so much for joining us today.
Thank you for having me.
We're going to start off right off the bat here with a question about how you got into optometry and what do you love about the work that you do?
I actually started thinking about this in the 5th grade. I've always loved the nervous system. I thought the brain was really cool and the eyes are an extension of the brain, so it was kind of perfect. And then going through undergrad, I volunteered, worked, shadowed at a couple of different healthcare disciplines. And optometry just seemed to be the best place where I got to speak with patients, connect with patients, their family, follow them throughout their lives, and just form those really deep relationships.
And what do you really love about what you do?
I have a specialty practice in binocular vision and advanced dry eye. So dry eye is something that I really, really love doing and seeing day to day. And it actually kind of started off because right before optometry school, I worked in makeup and beauty. So lots of heavy makeup, lots of makeup daily, and it actually turned me into a dry eye patient myself too. So this is a topic really near and dear to my heart.
Excellent. And we're going to be talking about dry eye today, and we
Perfect.
have a few questions, so we'll get to learn from you during our episode today. So thank you again for joining us.
My pleasure.
We're going to jump right into the questions here. And so for those who may not be familiar, what exactly is dry eye disease and what is happening in the eye when someone actually has it?
So for those unfamiliar, let's go through what should happen first to give us a little bit of context. So on your eyes, you're actually supposed to have 3 layers of tears at all times. It's not just when you're crying. These 3 layers are meant to stay on your eyes to hydrate your eyes, create a protective barrier, and it's meant to keep your vision stable. These 3 layers are meant to stay on your eyes for a solid 10 seconds. They're supposed to coexist in perfect harmony, and they're meant to be there at all times to give us these 3 things. If they're there, this is what gives us tear film homeostasis. Now, if they evaporate any less than that, then we don't have these 3 things, and that's what we have dry eye disease.
And so what can happen if we lose this homeostasis, and what symptoms could a patient be feeling?
So when we lose this homeostasis of the tear film, basically those 3 things that are meant to happen don't. So we don't have that protective layer, we don't have that protective barrier, the eyes can't be hydrated, and then we don't have stability of the vision either. So that's a big symptom actually when I have patients coming in right after maybe they update their glasses, vision's still unstable, and they can't figure out why. A lot of times they tell me it's either blurry or they feel like there's a film over their eye, but what they're experiencing is actually just nothingness. So like I said, the tear film's supposed to be on the eyes for 10 seconds. If it evaporates any less than that, then we're essentially looking through this waterfall. So when we have this tear film that's nice and stable, we're looking through a nice smooth surface. If it breaks up too quickly, anything under 10 seconds, we're basically looking through this waterfall. Could be 6 seconds, could be 2 seconds. It depends on how severe that dry eye is. So when that happens, we don't have that nice stable vision. When we blink, it might clear, but then it breaks up again just after a couple seconds. Now, a lot of times, this is actually the least of our worry.
Yeah.
Because when we have that exposure, right, there's a lot of things that can touch all those places, those open surfaces on the cornea or on the eye. So when this happens, say we have wind, dust, debris, literally just the air, right? When that touches the eye, it can create these little scratches. When we get these little scratches, it can feel like sand, right? It can feel gritty. It can feel like there's a foreign body in the eye.
And can these scratches go away?
They can, provided you let it. So if the eyes are healthy, these little scratches can go away in 24 to 48 hours. But if you don't let it heal, the scratches can become more, you can get deeper scratches, and then you try to rub your eyes to try to get the scratches to go away, and then that eyelid starts to chafe your eye, and then it just gets worse and worse. You just get more and more scratches.
And so speaking of the eyelid then, so is the eyelid not meant to touch the eye either?
No. Yeah, believe it or not, nothing's supposed to touch the eye. Not makeup, not the wind, air, dust, not contact lenses, not even your eyelid. It's supposed to be this smooth barrier, right? That your eyelid can glide over to basically blink, and then that tear film basically protects the eyes from any of these elements. Very much like your skin, right? Do you ever get dry skin, Mark?
Yep.
Yeah, I have very dry
right
skin.
now, actually.
Fantastic. So we can zoom in maybe with as
perfect.
examples, to show everyone. But when you have dry skin, right, that skin barrier is broken. That skin barrier is broken, and then you can get these cracks, and then you can bleed, and that hurts. That's painful. It burns. It stings, right? And that's oftentimes really easy to explain because with the skin you can see that. With the eyes you can't. But the same thing happens. If the eyes are dry, they crack, right? And that burns, that stings. Now, maybe it won't bleed like the hand does, but it's still painful. And that burning and stinging is a big symptom of dry eye disease as well.
And can someone have dry eyes without realizing it?
Yes. So for a couple of reasons. One reason could be that they're misunderstanding their symptoms. So another big symptom I see is watery eyes. So I'll maybe see the signs, and then I'll ask someone if they have dry eyes, and then they'll say, no, I have watery eyes. They're too wet. I tear too much. And here's the thing. Your body is really smart. Your body will know when the eyes are dry and try to make more tears. But the problem is they're not the right type of tears. They make more of the wet layer, which is the aqueous layer, but they might not be able to make more of the fat layer, which is supposed to keep the tears on your eyes. So then the eyes will make more and more and more tears, but then because they're not the right type, they flood your tears and then they spill. So that watery eye is a hallmark sign of dryness. And then we can also have patients who might just have a high pain tolerance, right? Where they have things that, they think it's a normal level discomfort. They think that being on the computer, things should burn or sting a bit. Makeup should make the eyes burn or sting a little bit. And then they ignore it. And then, a gland or two can die off, and that might be okay. But then when enough glands die off, it could be a little straw that breaks the camel back. And then at that point, it could be too late. The flip side of that is true as well, where the dry eye could be so severe that the corneal nerves could actually die off. And when that happens, we'll have the scratches, we'll have all the signs, but the patient won't feel it because the corneal nerves are already dead.
So many people hear the term dry eye and would assume it's just irritation or dryness, like you're saying, right? And so is dry eye actually considered a disease? And then what makes it a medical condition then if it is a disease?
Yeah. So let's break this down. A disease is a biological function that is not performing its intended task. So dry eye disease, by all accounts, falls under that definition. Essentially, we have this tear film, right, that we're supposed to be producing, but either the eyes can't make enough or it's making enough, but it can't stay on the eyes properly. And there's a lot of different reasons why this can be the case. So that's why the official definition of dry eye disease is that it's a multifactorial disease of the ocular surface characterized by a loss of that tear film homeostasis.
What are some of the main causes of dry eye?
So the main cause will depend on the type of dry eye disease you have. And there's three main types. There's aqueous deficient dry eye disease. So this is a loss of the function of the lacrimal gland. It can't produce enough tears, possibly because of autoimmune issues, drugs, medications, or corneal nerve damage. And then we have evaporative dry eye disease. So this is where you're making enough tears, but you can't keep them on your eyes. So usually it's because the lipid layer is missing because there's something going on with the meibomian glands.
And why would someone not produce enough of the oily layer?
So I have toys for this.
Okay, excellent.
Yes.
Here we go.
Okay. So here's a picture to make it easier to see. In your eyelids, you're meant to have about 25 glands on the upper lid and 30 glands on the bottom. These are called meibomian glands. The function of them is to secrete really nice clear oils that are meant to travel and flow to the front surface of your eyes to protect your tears from evaporating. Now, if that's not happening, right, then the tears will evaporate really quickly. And typically what happens is when those oils get clogged in the gland, they look almost like butter. So vegetable oil can flow really well, but if you think of butter, thick butter, right, trying to spread thick butter on, white toast doesn't work so well, right? So those oils are effectively stuck. They're in the glands, they can't come out, so you're missing that lipid layer on top of your eyes. So in a nutshell, that is meibomian gland dysfunction. Now, with meibomian gland dysfunction, we can go even further into things that can cause the meibomian glands to not function well. So one of those things would be blepharitis, or too much bacteria on your eyelids. So when you produce too much bacteria, right, you can get too much inflammation. If there's too much inflammation, you can get too much bacteria. So it becomes this vicious cycle. So one of the really big risk factors for this could be ocular rosacea or just too much inflammation in your diet in general.
And what other main risk factors are there for developing dry eye?
There are some big ones. So hormones is a really big one. So this is where it's very fun to be a woman because there are a lot of hormonal fluctuations in our lives, right? Pregnancy is a big one. Menopause is a big one as well. But just even everything in between, right? So there's PCOS, hormonal birth control, other things that can change our hormones. For men, there's thyroid disease as well. There's other hormonal disorders that can also trigger and cause this meibomian gland dysfunction or dry eye disease in general to take place. Now, menopause is one of the biggest ones because it's also coupled with another risk factor, which is age. And with age, there's just more time for things to go wrong. Dry eye disease is a progressive disease. So with more time, you can lose more glands over time. So that's one of the risk factors as well.
Right. So beyond all that, then, how big of a role does lifestyle play or lifestyle factors play in dry eye?
Oh, it's huge. So when you're on your device, you only blink 33% of the time that you're supposed to be blinking. That means that, you're not replenishing your tear film. You also have these little muscles in your eyelids that are meant to push out the oils that we were talking about. And when you're not blinking, you can't push these out. So it's one of those factors where if you don't use them, you can lose them. So that means that over time, right, if those muscles aren't working, the oils aren't being pumped out, you can actually lose the function and lose that gland altogether. So not only am I seeing the instant effects of dry eyes with screen use, I'm seeing the long-term effects as well.
And how common is this then? So dry eye, and then is it something you see frequently in your practice?
Yeah. So actually, there was a study done in Canada that was done in 2018 where it found that 21% of Canadians were dealing with dry eyes. And so that's over 1 in 5 Canadians, right? Yeah. But that was 2018. So ever since we had to work from home, increase our screen use, that number is probably even higher now.
And then how do you, in your practice, diagnose dry eye, and what does that process look like for patients?
So when we have the specific dry eye exam, what we typically start with is a symptom questionnaire. So as much as we want to assess, your signs on the objective measures, what really matters at the end of the day is this treatment making you feel better? Is this management making your eyes feel less of the symptoms that you came in with at a baseline? And then what we can do is we put this orange dye, this fluorescein on your eyes that makes your tears glow in the dark, so it's very fun. But it also allows me to see how your tear film is moving dynamically across your eyes. Where are the spots that are missing? If it's missing at the bottom, are you seeing a lot of scratches? Maybe you're not closing your eyes all the way, right? So this orange dye can also stain where you have the scratches, so we can see how big the patches are, where they are, how severe that might be. And then we also image your meibomian glands. So those glands that are supposed to push out those oils. And I have a picture to show you here as well.
Okay.
So this is fantastic technology because we can see exactly where your glands are at. So if your glands are nice and healthy, but maybe just a little bit clogged, right, they might look like this. So then treatment might be a little bit easier where we just have to push those oils out. But if that meibomian gland dysfunction is not being treated, or it's really severe, or perhaps a sty or infection has come into play, you can actually start getting inflammation of the glands. If there's too much inflammation or the oils can't come out, the glands can actually start to die off. And in these little areas right here, right, we can't bring them back. When the glands die off, we can't do anything to bring them back. So we always hope that we catch it before it gets to this stage. Because when it's really severe, when you've lost all your glands, there's nothing we can do to help make those glands better anymore. Mostly everything we have to do would have to be artificial.
And then what kind of a treatment, so in the worst case scenario, the treatment that would be involved in helping a patient with that condition would look like what?
So when we've lost all or most of our glands, the only thing we can try to do is replace that tear film artificially. So one thing would be scleral lenses. So putting the tears in a hard contact lens that's molded to your eye and just trying to keep that chamber of liquid on your eye. We can also use amniotic membrane, which essentially acts as a Band-Aid to try to speed up the healing of the front surface of the eyes. Because if you don't have enough tears, you'll have those scratches, right? So that would essentially heal those scratches. And then we could also draw your blood too to make tears. And there are some factors in the blood that can help to regenerate that damaged corneal surface as well. And then one more thing that we can do to just try to keep the tears on the eyes is using punctal plugs. So we basically try to block the drainage system so the tears stay on your eyes and they can't come out. But like I said, all these things are artificial, right? So we want to try to catch it before it gets to that stage so we can make your glands healthier, pump better oils, and then you're making your own natural tears.
And so what do we do to help the glands?
So hopefully we catch it early enough, right? Then we can work on ways to basically reduce the inflammation of the glands. So one of the ways that we reduce the inflammation of the glands is by using IPL or intense pulse light. So when the glands are really inflamed, right? They're supposed to look like this. There's supposed to be a nice opening. When they're really inflamed, they might look like this. That means there's no pathway for that oil to come out. So with intense pulse light, we reduce the inflammation, open up that pathway. So sometimes that's enough. We open up the pathway, the oils can come out, and we have that tear film again. But sometimes that oil is still too thick, and so we have to then melt it down. Okay? So I'm gonna show you this here as well. On the eyes, we have all of this skin, muscle, tissue before we actually reach the gland. So if we wanna melt it down, just using a warm compress or a heated mask might be difficult, right? May not heat the oil down all the way because it maybe won't be able to reach that far. So we can use thermal pulsation where we apply the heat from the inside and then we can deliver sustained heat to that gland and melt that oil down to push that to the front surface of the eyes. Then we have plasma energy. So this uses microcurrents to essentially do a little bit of what IPL and LipiFlow does. It can basically stimulate the cells to reduce inflammation from the glands, liquefy the oils, and then it also sanitizes the surface as well to basically clear off the bacteria and debris that you have on your eyelid margins.
So lots of options there. And so can dry eye be managed at home, or is it really a professional care environment that's needed?
That really depends. So that's why an eye exam is so important, so that we can see what kind of dry eye you have. Is it mild? Is it severe? And answer that question. Can it be managed at home, right? So I can walk you through some of those things, but there are certain things that can actually make the dry eye worse, and there are things that can make it better. So that's why it's so important to seek professional help first. Warm compresses are a great example of that, right? Because, using this model again, if we apply the warm compress, right, it can maybe travel to this gland and, heat that gland up to push the oils out. But if you already have a whole lot of inflammation there, right, putting that heat might just cause more inflammation and then increase that distance from your eyelid to the gland. So it may not actually reach the gland, it might just actually increase inflammation instead. So that's one of the things. Eyelid hygiene is something that we could all be better with, right? We have bacteria on the eyelids that can build up. We have plaque that can build up just like our teeth. And we're great at brushing our teeth, but we're not great at cleaning our eyes. Why? Right? Now, really specific is that on the eyes, you need to make sure that nothing you use has preservatives on it. So we're not using baby shampoo. We're not using face soap, right? We want to use specific either antibacterial wipes, antiseptic spray, or tea tree oil wipes. And depending on the type of bacteria, again, the type will matter based on what you have. So another good reason to get that checked out first. Then we also have omega-3s, which can help to decrease the inflammation of the glands, help to push out oils, right? But the potency and the purity has to be really high to be able to reach our oil glands. And then the last thing that usually is pretty safe to use across the board is preservative-free artificial tears. Really important thing to remember here is that preservatives can scratch your eyes and can actually make things worse. So the tears have to be preservative-free. Always better if they have special ingredients that's going to help to resolve the issues that you have as well. But a big thing is that we also want to be able to reduce, the need for artificial tears by helping you make your own oils as well. So coming to see an optometrist, having that dry eye check will direct you to exactly where you need to go.
So let's say someone has dry eye disease now and they decide to ignore it because they think it's mild. What happens over time?
Good question. So I saw this a lot because I come from the makeup world, right? So I'll see a patient in my chair who's maybe had eyelash extensions for 5 years, but then they've only had dry eye symptoms for the past year. Well, they think that it's not anything to do with the eyelash extensions because they've had it for so long and it hasn't caused an issue. But that dry eye disease can be a slow burn and it's progressive. So, poor hygiene over time, over the past 5 years, can start to kill off those glands, like I showed you earlier. And it could just get to that last gland or two that's holding on before you start to feel it. So over time, if you're not treating it, it will get worse. And sometimes it can become too late. So always better to solve it early because there's a lot more options that we have when you have enough glands.
Right. So for patients dealing with ongoing dry eye symptoms, what's your advice for them for managing it day to day and improving comfort and ultimately the quality of their life?
One thing is to not be afraid to use artificial tears. A lot of times we think that we can become reliant on them, right? But with every kind of misconception, there's always a little bit of truth. There are certain drops that you can use that will help reduce the redness of your eyes, but they're not actually doing anything to lubricate your eyes. So these are purely aesthetic. So definitely stay away from those because stopping the use of those can make your eyes more red. But if it's a true preservative-free artificial tear with good ingredients, then it's just meant to hydrate your eyes like we use moisturizer to hydrate our face or our hands.
Right.
The 20-20-20 rule is also great, right? We have to remember that we're blinking. So if you watch this far, thank you so much. But also remember to blink. And the most important thing really is see a professional. Seek to understand your dry eye disease. Seek to understand why it's happening. What is the root cause? What's not functioning properly? And then what can you do to help it? You can try 50 different tricks and have 50 different outcomes. But if you're not actually understanding what you need to do, none of those things will actually stick. So see an optometrist, see a professional, seek their guidance, and that will save you a lot of time and pain in the long run. Because at the end of the day, we really just want to make sure your eyes feel their best and see their best too.
So if there is one key takeaway that you would like to leave for our listeners today, what would that be?
See an optometrist. You need to see an optometrist to understand your dry eyes, to understand what's functioning properly, what's not functioning properly, so that you can treat it, you can manage it, and you can have healthy, happy eyes forever.
Dr. Wynn, I have one other question for you. Is it okay to use cucumbers when you're going for a relaxing day at a spa?
Good question. So cucumbers can maybe hydrate the eyes, but they got to be clean. We don't necessarily want any juice to get in our eyes. It's the cooling effect that helps, right? So maybe non-organic matter that's cool is a little bit better.
Perfect.
Yeah.
Dr. Wynn, thank you so much for joining us today. This was a fantastically informative conversation. So thank you very much for being with us today. And
thank you so much for having me. Thank you for the series. This has been great.
Awesome. Thank you.
Dry eye is more than just a minor irritation. It can really impact your day-to-day life. And as Dr. Wynn said, it can also be linked to a range of underlying health issues. If you're experiencing symptoms or haven't had a comprehensive eye exam recently, this is your reminder. Your vision matters, and so does your long-term eye health. Thank you for joining us. If you've learned something new, hit the like button, subscribe, share a link with your friends, and stay tuned for another Visionary Voices in Optometry. We'll see you next time.